tips to navigate online dating, plus how to impress your partner when you don't have a lot of experience. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, our very own Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Let's get right to our first question.
Absolutely. Well, here we go, Dr. Leah. A man says, I just started online dating, but I'm not getting any matches. Any tricks to making a profile attractive?
There's a lot of dating sites out there, so it's important to be on the right one for both you and your age. Tinder is one of the most popular dating sites, but most of the users are under 25. Happen is a free site that uses GPS to find users near you, but most of its users are in their 20s as well. For 30-somethings, there are sites like Match or Hinge, and there are sites for seniors too, including Our Time, Silver Singles, and Date My Age. Grindr is one of the most popular gay dating sites, and it's been around since 2009.
There's so many options, Dr. Leah. So how do they know if they're on the right site? And what can they do to enhance their profile?
Okay, so if you feel like you're on the right site, you may want to rework your profile. Look at others on the site to get ideas for things to include in yours. Be positive about yourself and give specific examples. Talk about your favorite places, your favorite food, and why you like them. Try adding a question at the end to help start a conversation with someone who may be interested.
Dr. Leah, how about pictures? Are those important? Is that correct?
Yeah, include a couple of headshots that show you smiling and happy without sunglasses. Some research has found that half of daters like photos that show someone engaging in a fun sport or activity. And make sure they're recent. It is important to keep your whole profile up to date, so review it regularly and make changes as needed.
You know, you see a lot of these profile pictures and you can tell they're edited. They've got these filters on and trying to make the girl look prettier, or, you know, flawless skin, and the guy maybe more rugged. You know, what about editing the photos? Is that advisable?
You know, I don't think if there's a small amount of editing, it's really the end of the world. But the problem really is all too often, and I hear this from guys all the time, they say they go on dates with these girls and they look absolutely nothing like their profile picture, and so they're disappointed, whether they edited it quite a bit or they gained a bunch of weight. I mean, it's just important to be true to your authentic self. And what I don't understand, like, I'd rather have someone be pleasantly surprised than like, oh, she looks bad in real life, but she looked great in her edited photos, you know? Represent your true self.
A viewer wants to know, Dr. Leah, how can I prevent ingrown hairs, especially in private areas?
Well, here are some ways to prevent ingrown hairs. Soak your skin in warm water to soften the pubic hair, or use an oil or lotion to soften it. Gently exfoliate the area. If you're shaving, make sure that razor is sharp, no dull razors, and use a shaving cream or any type of moisturizing conditioner. And wet the area first and then pat dry. Afterwards, use a skin cream that has salicylic or glycolic acid in it.
That's a mouthful, salicylic and glycolic. That's incredible. Dr. Leah, what if this is a common issue for our viewer?
Well, if you're bothered a lot by ingrown hairs, you might consider a long-term treatment like laser hair removal. Although I will warn people, a lot of times they'll say that 6 treatments and magically work. I don't know. 6 didn't work for me. I don't know if it's my thick hair or taking, you know, too many vitamins, but it doesn't always work as quickly. So I would definitely tell people to be patient. It is a very long process for a lot of people. So it can be a little bit more expensive than you may have planned.
Okay, I mean, I thankfully don't suffer from that. But what if you already have an ingrown hair? What can you do?
The good news is that most ingrown hairs will take care of themselves without treatment. But if it's itchy or painful, here are some tips there. So you want to use a hot compress soaked in warm water, which can help the hair come to the surface. Then you can pluck it out with a clean, sterilized tweezer.
So, I mean, pluck it out. So you should never cut it or anything, right? Because I mean, the temptation is to like pierce it like a pimple and maybe pull that hair out. That's
no,
so don't
and
do
actually, and dermatologists say you shouldn't be doing that with pimples either, because the reality is, whenever you open up your skin, you're really opening it up to bacteria, right? I mean, the majority of us, if you pop a pimple, we're all guilty of it. You're not sitting there with like alcohol making sure it's healthy. You kind of pop and go, right? And same thing with tweezers. I mean, I don't sterilize my tweezers every night. That's just not something that I do. So whenever you're opening up the skin, you just have to be more cautious.
Okay. Our next question. A woman wants to know, why did I lose my sex drive after having a hysterectomy?
Well, it's common for women who've had a complete hysterectomy to lose their sex drive. One reason is that when ovaries are removed, you no longer produce hormones such as estrogen and progesterone, an androgen which is partially responsible for a woman's sex drive. A hysterectomy can also have an emotional impact on you and your feelings about sex. This could be due to your situation, maybe why you needed surgery, and if the surgery induced menopause.
Okay, Dr. Leah, so what are some solutions?
Well, first make sure that you're completely healed from the operation, which takes about 6 to 8 weeks. Keep in mind that everyone heals differently, so follow your doctor's recommendations before having sex. If you still feel a lack of interest in sex, there are some things you could try. Get your partner involved. Talk to your partner and explain how you are feeling. Just remember to always be honest.
Dr. Leah, what are other ways to involve your partner?
Try spending more time on foreplay to get them in the mood. Shake things up with role playing or trying out different positions. And ask your partner to spend more time arousing you by concentrating on your clitoris and labia.
You know, I'm sure a lot of women have this question. Is sex uncomfortable after hysterectomy?
Well, yeah, I mean, if you're feeling discomfort during sex, use a lubricant. You can be experiencing vaginal dryness, and lubrication can help by having intercourse, making it a little easier and more enjoyable. And if you're experiencing menopause because of the surgery, definitely talk to your doctor. There may be other resources that could help, like hormone therapy.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to AskDrLeah.com.
Still to come on Sex Talk. Tips for increasing emotional intimacy. Taking it to the streets. Perimenopause.
We talk a lot about physical intimacy, but emotional intimacy is just as important.
Emotional intimacy is the foundation of a healthy relationship. It's the closeness from sharing your feelings with your partner. But maintaining emotional intimacy can be a challenge, especially as time goes on. So here are some tips to help you increase your emotional intimacy in your relationship. It's important to create a safe space for open and honest communication. This means actively listening to your partner, being respectful, and validating their feelings. You should also try to express your own feelings and needs clearly, so your partner can understand and respond in a supportive way. Practice empathy and understanding. Try to see things from your partner's perspective and be supportive and understanding of their feelings and experiences. This will help build trust and deepen your emotional connection. Be vulnerable. Sharing your fears, hopes, and dreams with your partner can be scary, but it can also bring you closer together. Being vulnerable and sharing your true self with your partner can help build trust and deepen your emotional connection. Spend quality time together. It's important to make time for each other and prioritize your relationship. This could mean having a date night once a week, taking a weekend getaway, or simply setting aside time each day to connect and check in with each other. And don't forget physical touch. Touch is a powerful way to communicate love and affection, and it can help strengthen emotional intimacy. So make sure to show physical affection regularly, whether it's holding hands, hugging, or cuddling.
And don't forget to have fun. Laughing together and being playful can reduce stress and help you connect with your partner. Coming up, is solo pleasure okay in a marriage? And what should you do if you've never been tested for STIs? That's next.
Do you think opposites attract?
No, not necessarily.
Yes, absolutely.
Absolutely, yeah.
100%.
We're probably the definition
Yeah, we
of
are
that.
so opposite.
I think you have to be more similar, honestly, than opposite. So no.
I think at first, then like as time goes by, that kind of fades away, and you don't have much to talk about afterwards. So.
You know what, doctor? Yes. And for me, in my case, absolutely, I have a beautiful wife of 21 years next month, and we are very different.
Do you guys think opposites attract? Are you guys opposites?
Yes, we are. I'm from the city, he's from the country. I'm from the north, he's from the south.
She's white and I'm black.
Yeah, there you go. Yeah.
What the heck?
Yeah. I'm fast, he's slow.
There you go.
I love it. I love it. What is your favorite way to be intimate without like anything sexual?
Well, I'm very touchy without that. I think you can like massages and even holding hands and even shoulder rubs, you know, brushing hair, just those little things.
Ooh, do you brush his hair?
Absolutely. I am a hairstylist and I love playing with hair.
I think the hugging, you know, like she lays on my chest.
Connection, of course. Talking to each other. Like, you know,
Respect
touching each other, hugging each other. It's so nice.
Respect each
Watching
other.
it together, it's nice.
Yeah.
It's nice. It's cute.
Back here on Sex Talk. Now let's take some more questions from our viewers.
Dr. Leah, a woman says, I've never had an STI test. How do I know what to get tested for?
Well, I'm glad you decided to get tested. Everyone should if they've had unprotected sex. But before we get into which test you should have, let me explain the difference between an STI and an STD, sexually transmitted disease and sexually transmitted infection. First off, they're typically used interchangeably. So it's important to get tested early because most of the time sexually transmitted infections don't have any symptoms. You can also unknowingly spread the infection to other partners. It is important to test early because infections can lead to disease. For example, chlamydia and gonorrhea can become pelvic inflammatory disease.
Dr. Leah, you said get tested early. When do you get tested?
Well, that's exactly my point, right? So you should be getting tested anytime you've had unprotected sex, but you really should be getting tested, really should be getting tested if you see any signs or symptoms, right? Often you won't see them, but if you're seeing any like itching or burning or anything like that when you're urinating, you definitely want to get tested. But don't freak out. It doesn't necessarily mean that it's a sexually transmitted infection. It could be something simple like a UTI. But either way, it's just better to know and better to get tested so that you're not transmitting it to anybody else.
So our viewer shouldn't freak out. So what can we tell our viewer about the tests?
Well, there are three main types of tests that you will get. A blood test will check for syphilis, HIV, and sometimes herpes. A swab test is where they take a sample from the vagina or cervix in women and the urethra in men. It tests for HPV, chlamydia, or gonorrhea. The third test is a urine test that checks for trich and sometimes gonorrhea.
Are there any other types of tests?
Well, it's pretty rare, but if your doctor feels like you've got a really advanced stage syphilis, they might order a lumbar puncture or a spinal tap to check to see if the infection has affected your brain or spinal cord. Again, very rare.
Good. Dr. Leah, the following question, I'm sure it relates to a lot of our viewers and our demographic. There's a man says, I am healthy and 61. The only problem is when I ejaculate, it's not forceful. Is there anything I can do to increase the flow?
Well, there are things you can do, but first let's make sure that there are no underlying health problems. You should see your doctor if this problem has lasted a long time and also have checked for low hormone levels, which naturally decrease as you get older and affect the force of your ejaculation. Alcohol use could also play a role as it may reduce the blood flow to your penis and depress the central nervous system. Plus, heavy alcohol consumption results in reduced testosterone levels in the blood.
Okay, doctor, so let's say the doctors, they say that everything, that they're in the clear. Now what?
Well, if your doctor says everything's good, then the cause could be a psychological problem like depression, but it's most likely just because you're getting older. Just as age weakens our muscles and changes our eyesight, it can reduce both the strength and volume of your ejaculation. If it is still bothering you, you can try to strengthen your pelvic muscle through Kegel exercises.
Kegel exercises, Dr. Leah, how do you do Kegel exercises? I thought that was just for women.
Well, pelvic floor muscles support the organs in your pelvis and hold them in place while assisting things like going to the bathroom. Kegel exercises are quite simple and they can be completed anywhere. They're exercises that involve the tightening and releasing of the muscles that you would use to stop urine when you're urinating. So to practice, you just stop it once. You don't want to do these exercises while you're urinating, but just so that you can identify those muscles. And then you just want to kind of clench those muscles for about a count of 10, release for a count of 10, and again, and then work your way up until you can do this approximately 30 times a day.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to AskDrLeah.com.
Still ahead on Sex Talk. Perimenopause. Is solo pleasure okay in a marriage? What's the best female oral contraceptive? New to sex? Tips for improving sexual experiences.
Is your body experiencing changes that you can't explain, like hot flashes, mood swings, or irregular periods? It could be perimenopause.
Perimenopause is a natural transition in a woman's life that typically occurs in the late 30s to early 50s. During this time, the body's production of estrogen and progesterone, two hormones that regulate the menstrual cycle, begins to fluctuate, leading to a range of physical and emotional changes. One of the most common symptoms of perimenopause is irregular periods, which can be heavier, lighter, or less frequent than usual. Women may also experience hot flashes, night sweats, mood swings, and sleep disturbances. These symptoms can be mild or severe, and they can last for several years. While perimenopause is a normal part of the aging process, it can be a challenging time for many women. It's important to talk to your healthcare provider about your symptoms, as there are a variety of treatments available that can help manage them. For example, hormone replacement therapy, or HRT, can be effective in reducing hot flashes and other symptoms. However, HRT is not right for everyone, and your healthcare provider can help you determine the best course of treatment for your individual needs. In addition to medical treatments, there are also lifestyle changes that can help alleviate perimenopausal symptoms. Eating a healthy diet, getting regular exercise, and reducing stress can all be beneficial. Women may also find relief from alternative therapies, such as acupuncture, yoga, and meditation. It's important to remember that perimenopause is a normal and natural part of life, and that every woman's experience is unique. While it can be challenging, it's also an opportunity to take care of yourself and make positive changes that can improve your overall health and well-being.
If you have any of those symptoms, talk to your doctor and they can develop a plan for you. Let's take on some more questions.
Dr. Leah, a man says, my wife doesn't want me to do anything sexual by myself, but sometimes it's more convenient. It seems healthy, but my wife doesn't think so. What can we do to help this guy?
Well, it sounds like he's discussed this with his wife, but maybe it's time for another conversation. You need to explain to her why you want to masturbate. You mentioned in your question that it's sometimes more convenient to self-pleasure. Is that because you feel your wife is less interested in having sex than you are? If so, ask her why she feels the way she does. She may feel that it takes away time that you both could be spending together being intimate. See if there are any compromises you both can agree on and give her time to consider her feelings.
So, Dr. Leah, would you say masturbation is good or bad in a marriage?
Well, it can be good for a marriage, as it can boost sexual self-esteem and help you discover ways that are best reach an orgasm. But it can also have some negative effects, especially if it becomes excessive. It could definitely interfere with your relationship and other areas of your life.
Okay, thank you. Great answer. Dr. Leah, a woman wants to know, what's the best female oral contraceptive?
A lot of women prefer the combined birth control pill. It has both estrogen and progesterone, and there are many varieties to choose from. You could go with a conventional type that has 24 active pills and 4 inactive, or 21 active and 7 inactive. Or you choose the continuous dosing or the extended cycle pills that contain 84 active pills and 7 inactive. With this type of birth control, you'll only menstruate 4 times a year. There are types that contain only active pills to eliminate bleeding. Keep in mind that breakthrough bleeding is much more common with these types of pills.
Dr. Leah, is there a pill that is not combined?
Yes, there is one that only contains progestin, no estrogen. All of the pills have the same dose of progestin in them, and so that there are no inactive pills. These may be best for women who are over 35.
So Dr. Leah, how does hormonal birth control work?
Birth control prevents your ovaries from releasing an egg. Plus, it thickens cervical mucus, the thin lining of your uterus. And it slows the egg's progress through fallopian tubes. It can also suppress ovulation.
I have a follow-up question because I took notes because there's a lot of numbers and a lot of words. You talk about the 24 active pills, 4 inactive, this, 7 that, 84 active pills. You also talk about progestin, estrogen. I mean, all kinds of birth control. How do you know what's appropriate for everyone? Are they all appropriate?
No, they're not all appropriate for everyone. You should discuss your medical history and the medications you are taking with your doctor to determine which type is the best for you. The combination type may not be good for you if you just gave birth, or if you're over 35 and smoke, or have high blood pressure, or any history of breast cancer or heart disease. The mini pill may not be right for you if you've got breast cancer, certain types of liver diseases, any unexplained uterine bleeding, or taking any anti-tuberculosis agents.
Dr. Lear, here's a catch-22 question, and I want to see how you're going to handle it. A man wants to know, how can I get better at sex when I don't have a lot of experience?
Right. It's just like when you apply for a job, right? They have a requirement of experience, but you can't get experience without having the job, right? Well, the first thing you can do is look for articles online and books about sexual technique. I've got mixed opinions on watching porn. It may be useful for some pointers, but don't feel like you have to live up to that standard. Just remember, porn is entertainment. It's much more entertainment than it is a real life scenario. So also try not to be anxious about it. It can make you feel a little awkward, and it can make the experience unenjoyable for both you and your partner. So try to relax, take hints from what your partner is doing, and don't be afraid to ask them what they like. Remember, not all people are the same, and this way you can learn how to pleasure your partner from your partner. Also, don't try anything too complicated at first. If it fails, it may cause you to worry or feel even more insecure than you already are. Keep it simple, right? You'll get more confidence and feel more comfortable in trying new things or new positions. But keep your sense of humor handy when things don't go right. No matter how inexperienced you are at sex, things can go wrong at any moment.
You know, it's great advice, especially the part about, tell them what you want or what's going to help. Because as men, sometimes we just don't know if we're, touching the right place or soft enough or hard enough. Because like you said, everybody is different, so that's great advice.
Yeah, ask away, absolutely.
Absolutely, don't be shy. Dr. Leah, what if the sexy time fails? What else?
You have to have a sense of humor. Everybody I know has a sexy time fail. It makes a great conversation starter, let me tell you. Even with me, I was reading that cinnamon oil and lubricant helps enhance all the feelings, and it just really burns, and it's not fun. And so, fortunately, it's not dangerous. It's similar to eating a hot pepper. You feel the burning sensation, but it's not like an acid. It's not going to cause any harm to the skin, but it's certainly a mood kill when you have to stop and jump in the shower. So, I mean, everybody's had them. Derek, what are your sexy time fails?
Like a sexy time fail? Well, for example, at one time, I thought I put on some nice romantic music to get in the mood, and it turned out that she kind of left because it reminded her of her ex-boyfriend, and that kind of was it. So it always doesn't work. And another time we tried the CBD thing, and that was nice side effects on that one, so that one kind of worked. But thank you for asking, Dr. Leah.
Well, and actually, I can tell you CBD was another fail of mine. Oh. My husband hates the smell of anything marijuana related, so the second even that was brought out was like, oh, this smells awful, Yeah. So it works for some people, it's great for some couples, but not for everybody. So thank you for reminding me of yet another sexy time fail. Thank you, Derek.
And that's what I'm here for, Dr. Leah.
Exactly.
I got your back.
Thanks. Well, that is all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.